This is our PCAF workshop. We're with you for 1.5 hours, and we're going to give you presentations which will last approximately an hour, and then we'll have 30 minutes for questions. I'm also able to offer an email for you which you might like to take a note of. I'm going to put this in the chat box now. And in relation to the PCAF award scheme, if they're really related to the rules of applying, please do approach the NIHR. But if you're particularly keen to apply with us at our Centre for Research and Applied Health, please do feel free to contact us as a follow-up. So I've added our email address there to the event. Now I'm just going to share a couple of slides to show you the itinerary we've planned for today. So our Centre for Applied Health and Social Care, this is the core team who focus pretty much exclusively on research, but we have a faculty of 180 academics across health and social care, including all the core professional groups. So we're quite a large team, and we're embedded in 2 universities, University of London, St George's University of London, which is the UK's only specialist healthcare university, and Kingston University, which has a broad range of areas, including pharmacy as well. So under the joint faculty, we have some of our areas awarded by St George's, such as occupational therapy, physiotherapy, paramedic science, and also radiography. And under Kingston University, we have areas such as social work, all of the nursing areas, and midwifery, so quite a broad spread. And if you could just have a look at this schedule for you. So after I've welcomed you, I'll be handing over to Professor Tom Quinn, and Professor Tom Quinn will introduce himself and tell you quite a bit of detail about the PCAF scheme. Tom is a member of our team, and he's also a panel member, and has been a panel member for a couple of years of this particular funding stream. So he's very on top of the rules of engagement and can support you with knowing what the criteria are. Then I'm going to give you a few more slides in relation to what to look for in an academic host site. We have successfully secured PCAF fellows for every year at which the scheme has been open for, and have quite a strong track record in this area. So I'm going to give you some top tips from that point of view. Then I'll be passing over to Dr. Jackie McRae, speech therapist, I'm sure well known to many of you because she was at the Nightingale Hospital and is a national advocate for speech therapy for the NIHR for clinical academic careers. And Jackie will introduce to you 2 of our current PCAF award holders, Anna Robinson and Greg Booth, who will talk to you about their experiences of the scheme and their applications. Then I will hand over to Dr. Kirstie Coxon, another one of our team. Kirstie is a national advocate for clinical academic careers for midwifery, and she also is the South London clinical academic training lead. So we shall hand over to Kirstie for further top tips on applying, and then we will come to our question and answer session. So I will hand over to my colleague Tom to present to you.
Thank you very much, everybody, and welcome to the event. I'm Tom Quinn. I'm a cardiac nurse. I work in the joint faculty. And just to say thank you to everybody for all that you're doing during these very, very difficult times. I'd like to thank Beth Harries from NIHR, who's allowed me to use some of her slides. So the National Institute for Health Research is our national body, the mission of which is to improve the health and wealth of the nation through research. So very, very important part of our health and social care system. And one of the key strategic ambitions of NIHR, of course, is to increase the number of people who have clinical academic roles. So that means preparing people to lead research in the future whilst maintaining a clinical role. And you'll see here the column that leads you from an internship all the way through to a senior clinical lectureship and possibly even on to professor. And you'll see the red block there that sets out what we're talking about today, which is the pre-doctoral clinical academic fellowship. And the purpose of the PCAF fellowship is to develop a competitive doctoral fellowship application. To do that, the funding through PCAF allows bespoke training for individual clinicians to, for example, complete a master's degree, undertake master's modules, train in research methodologies, do leadership training, PPI training, and perhaps even to prepare some research outputs to build. The training program is there to allow clinicians to gain research experience, to develop skills in their own specialty, including not just research, but your clinical development and professional development, to allow you to undertake placements across the country or even abroad sometimes with other research groups or centres in your area of interest, funding to attend conferences, funding to do research visits. And there are two different bits of the PCAF. One is the standard PCAF, which is a full-time 12-month fellowship or part-time over 24 months, sorry, or the bridge, and I'll explain the difference between these, which allows 4 days per week for 6 months full-time or 2 days a week for 12 months. And you'll see that the standard PCAF is for those who are starting, perhaps haven't got a master's or a previous NIHR or Health Education England Research Award. It'll pay salaries for the time that the fellowship is undertaken. It'll pay up to £5,000 towards master's level training, including travel and subsistence. Pay up to £1,000 for conference fees and up to £1,000 for supervision and mentorship costs. The PCAF Bridge, which is of course a shorter fellowship, will pay salary costs, pay up to £500 for conference meeting fees, up to £400 for formal courses, up to £500 for supervision, because the people going for PCAF Bridge will typically already have a previous award, will have done an MRes or similar research training at master's level. So who can apply? Well, the key thing is that you're one of the eligible professions and that you are registered with your relevant professional body or council, that you have at least 1 year of clinical practice under your belt, that you're employed by a provider of health or care services that is providing at least 50% of its services free at the point of delivery. You'll be spending at least 50% of your current role delivering health and or care services, again, that are free at the point of delivery. And here's a list of the eligible professions. I'll just leave that up there for a few seconds, and you'll see that it includes people registered by HCPC, NMC, the General Osteopathic Council, the Academy for Healthcare Science. Who can't apply for this are people who are already doing a PhD or have registered for an MPhil with the expectation this will progress to a PhD. And for those who are applying for the standard PCAF, not the bridge, then they must not have held a previous Health Education England or NIHR clinical academic training or integrated clinical academic master's studentship. Because we'd be hoping that you'll have done most of your pre-doctoral preparation work during those funded programs. Now, one of the benefits of these schemes is that you remain in your professional role and you get funding not just to develop your research skills, but to develop your clinical skills, because we want future clinical academic leaders. And you can apply for up to 20% of professional development time through this grant. So that's a very, very brief tour of PCAF. PCAF is for those who want a clinical academic career, who want funded time and space and support to develop their doctoral application. That's all I'm going to say at this point. And what we'll do is we will cover more detail in the questions section at the end. Thank you.
Thank you very much, Tom. Thank you. Okay, so what do you want to look for in an academic host site? Well, here are 4 points I thought of, and I'll just give you a few illustrative examples from our experience to help you as well. So the funding panels are generally looking for centres where there's a good track record in supporting clinical academics, a strong track record in doctoral supervision, and a track record really in securing NIHR fellowship awards. So they demonstrate that capacity, and academic experts who can support you to apply. I'll give you a few examples in a moment. Also, you want to look for a research centre of excellence in your area of research. So in some universities, you have research centres of excellence which are university-wide. These are commonly called institutes. Sometimes you also have research groups, which are probably faculty or school-based. So if you can identify a research centre which focuses on the area of research you're interested in, it's important it's really got that strength of calibre of people doing research around that field, because that'll really help to embed you in a team who understand your field of research. Public and patient engagement and involvement is incredibly important, and we should always be undertaking research which is really desired by those particular people who it could benefit. And so NIHR is always looking for that element in any application. So you need to find an academics host site which has a clear track record in public and patient engagement. You also need to look for experts in your particular field of interest, and think not just about the actual clinical or social care area, but also about the methodological expertise to make sure all those areas are going to be properly looked after to cover you. So just to give you a few examples, in our university, we obviously are part of both St George's University of London and part of Kingston University. And in our joint faculty, which as you can see the logo at the top here, we have our Centre for Applied Health and Social Care Research, which focuses on the professions which are aligned with the PCAF list, which Tom just shared with you. So one of our research groups within our centre is the Healthcare Education and Evaluation Research Group. So if you're interested in that type of field of research, that's led by Anne Ooms, and she has a whole team of people to support. So for example, Anne's doing research at the moment with St George's Hospital, evaluating the interventions in palliative care which have been implemented there. We also have Dimitra's and Kirstie's Inclusive Health and Wellbeing Research Group. So they particularly focus on rare conditions, and Dimitra is a physiotherapist and Kirstie a midwife. Fiona Jones, professor and physiotherapist, leads the Implementation and Improvement Science Group. And so where you're looking to improve delivery of services across the board, this may suit you. So Fiona's well known for her self-management of long-term health conditions research in terms of particularly in stroke originally, but now broadened out to many other areas. Other researchers in her team include Professor Mike Hurley. He developed the Escape Pain Programme, which was recently on the news, demonstrating great savings to the NHS. We also have colleagues in that group, such as Vari Drennan and Mary Holter, who undertake national research on workforce development and health services research. Health services research is permitted within the NIHR criteria for PCAF awards. Professor Tom Quinn, who you've just heard from, leads the Emergency Cardiovascular and Critical Care Research Group and is able to supervise quite a wide range of projects with his colleagues, and currently hosts one of our PCAF awardees, who's a physiotherapist, but he also has a strong track record in supervising PhDs for paramedic science. One of his colleagues in his group is Johannes Mellenhoff. For example, he just published a survey on PPE availability. We also have the Psychological and Cognitive Research group led by Professor Mary Chambers. Mary Chambers is a professor of mental health, And she leads this group along with also leading our Centre for Public and Patient Engagement. One of the colleagues within Mary's group is Impact Assessor for Unit of Assessment 3 in the REF, which demonstrates the strength of impact which the research we have in the centre undertakes. So we've got an example here as well for public and patient involvement. Irena, who is currently a member of Mary's research group, but is just about to launch a specialist research group for intellectual disability and palliative care. Irena undertook a research training course to support people with learning disabilities to become co-researchers. So this is a wonderful photograph of them with their certificates when they completed the course. And she's just appointed Richard, a member of our colleagues now, who has a learning disability himself. And he is a co-researcher on an NIHR funded grant with Irena, which demonstrates our capacity to work together with those people who our research is there for. So looking more broadly at the universities, so for example, at St George's, we have 3 research institutes: the Molecular and Clinical Sciences Institute, Infection and Immunity, and Population Health. So in addition to being a member of the centre, you could also be involved with seminar programmes and research group meetings for these areas. So if we take one of these areas, you will see, for example, in one of the institutes, they have cardiovascular research. This is a CAG, a clinical academic group, together with St George's Hospital. And we are actually co-located in St George's Hospital, which is quite unusual for a university. They also have a neurosciences research group. And we do have colleagues in this group pursuing postdoctoral NIHR fellowship awards, demonstrating the strength of research through the full clinical academic pathway. So again, I also mentioned to you that you also want to look for the expert in your field. So here's a few CVs, for example, of our team. So Jackie McRae in speech therapy, and Deborah Harding, also speech therapist, but well known for her work on leadership and supervision through Health Education England. Dr. Marcus Jackson, for example, can supervise radiography PCAF applicants. And Professor Jane Price is a specialist in paediatric or children's palliative care. Dr. Linda Collins is one of our, came from a research background in clinical practice to us, and she is an expert in incontinence and a nurse. Dr. John Hammond, physiotherapist. Professor Ream is actually a pharmacist and able to supervise pharmacy applicants, another strand of the professions involved with the PCAF awards. And here we have Ingrid Bacon, who's an occupational therapist. We also have a professor of social work, Rick Hood, who's just been recently appointed to full research professorial status. So I'll just stop sharing there, but I hope that's given you a little bit of an insight there into what to look for. So you're looking for a good strategic broad group. In our team as well, we do have members of all the panels. So for example, I'm on the clinical doctoral panel, as is Kirstie, Tom on the PCAF panel, and Fiona Jones is on the lecturer and senior lecturer awarding panel. We're also, several of us, myself and Jackie, mentors for the clinical doctoral fellows and have been since the inception of the scheme. So we're very familiar with the scheme and we know what it takes to put those complex applications together to make sure you're successful. So do look for those attributes wherever you're looking for your academic host. The most important thing is you find the host that can provide the expertise to you in the area of your interest. So I'm now going to pass over to Jackie, who's going to introduce 2 of our current PCAF members to you. Thank you, Jackie.
Thank you very much, Priscilla, and I hope the information has been useful so far. And thank you also for the steady stream of questions, which I'm collating for our Q&A at the end. I myself was very fortunate to undertake a NIHR MClinRes about 10 years ago now, and then went on to do my CDRF, which is the Clinical Doctoral Research Fellowship following that. So I know what an excellent scheme the NIHR schemes are. What I'd like to do now is to ask Anna Robinson and Greg Booth to present a little bit about their experience. So if Anna could come on. Anna is a speech and language therapist by background. I'm sure she'll introduce herself in a moment. And Greg is a physio. So if we have Anna presenting first, if you're ready.
Yeah, I'm ready. Great. So thank you, Jackie. My name's Anna. I'm a speech and language therapist. I currently work at CNWL NHS Trust, working with adults with communication and swallowing difficulties who in the community. And it's patients who've had strokes or other neurological conditions or patients with dementia. I applied for the NIHR PCAF Bridge last spring and found out I was successful last summer, and I've just started the bridge scheme last week, so it's fairly new to me. My primary academic host is UCL, and my secondary academic host is Kingston and St George's, hence all the logos on here. So today I'll talk to you for about 10 minutes about I'll give a bit of background as to my research career and how I've got to the point of applying for this scheme and what I'm hoping to do next. And then I'll talk through how I approached the application process, and finally a few kind of top tips from what I learned doing the application. So first of all, I'll just give a bit of background, and this is the sort of thing I wrote in my research career to date section of the application form for the PCAF Bridge. So I qualified as a speech therapist in 2013 at City University on the master's programme. I had a chance to do a sort of research dissertation there, and I also volunteered on some research studies. So that kind of sparked my initial interest in research. I then went on to work clinically, firstly in hospitals, and I proceeded then to work in the community, and I found my heart kind of lay in working with patients and families in their homes as a speech therapist. Whilst I was working in the community, a colleague of mine did the MRes CLIN, the research masters funded by NIHR, and I applied for it. First of all, I didn't get on, actually. I was on the waiting list, and then I got a place. So I spent a year at St George's University on the MRes, which I think for me was a kind of point where I realised research is what I want to do. Kind of clinical academia is where I want to go. And I met lots of excellent supervisors there. I was able to do a research study as part of the Masters. I explored family members' experiences of swallowing difficulties after stroke, and I was interviewing patients' families and analysing that thematically. At St George's, my supervisor was Dr. Melania Kalstani, who's done a lot of ethnography healthcare research, and she has now become one of my supervisors for the PCAF Bridge. Whilst I was doing the MRes, I also met Dr. Suzanne Beek at UCL, and she's a professor of speech and language therapy and has done lots of research in dementia, which I'll go on to, but that was a good chance to meet her, she's now become my primary academic supervisor for the PCAF Bridge. When I finished the MRes, I wasn't done with research, and so I decided to work for a year in stroke research at UCLH, where I was working on kind of big multi-centre stroke trials, which gave me a really good insight into how big research studies are run, but it wasn't particularly speech therapy related. I then moved on to more community-based research. So I worked at Oxford Health in a dementia research team. I did this for 2 days a week alongside clinical workers and SLT in the community. And I loved the dementia research job because I was working with patients in the community, but doing research with them. And that was where I met Dr. Kathy Henschel, who has become my clinical mentor for the PCAF Bridge. She's a nurse by background, but she's quite involved with the NIHR. So whilst I was doing this kind of clinical work 3 days, dementia research 2 days, I applied for the PCAF Bridge. And what I'm applying to look at in the PCAF Bridge and beyond is developing our understanding of dementia patients' communication needs, how that impacts on their quality of life, and how speech therapy services meet those needs. And I'm considering using methods such as consensus, like Delphi consensus, ethnography, or co-design, and that's what I'm going to be exploring in the PCAF Bridge, kind of developing my PhD question. So, of course, the plan hopefully is to apply for the CDRF, the doctoral research fellowship next year, and hopefully continue on to do kind of a mixture of clinical and academic work. what I tried to show in my application for the PCAF Bridge was how all these kind of quite disparate experiences I've had over the past few years, how they come together to bring me to a point now where the PCAF Bridge and PhD is the right thing for me. So I tried to bring out some key themes in my career to date, which is the consistent research interest, and my enthusiasm for working closely with patients and families, looking at their life participation and quality of life. So although I've worked with stroke and dementia, I'm hoping that, you know, I can bring that experience together into something useful in speech therapy research. So when I approached the application, I first tried to see, you know, is the PCAF Bridge the right thing for me at this point? And the NIHR said, for the PCAF Bridge, you should already have research experience, and you should be able to pretty much undertake a PhD now, but need a bit of time to develop your application for the PhD. I think for me that was ideal because I tend to have lots of different ideas, and I just need some time to really get them on paper and plan what I want to do for the PhD. I read up on the website on the NIHR to work out, you know, what exactly I would need to do for the application. I soon realised it wasn't just about filling out an application form, but it's almost a mini project in itself, completing this PCAF application. Early on, I discussed with my clinical line manager and clinical team, because you need their support, not only in writing a supporting statement in the application, but also to help you continue to develop clinically as well as academically. I considered who to have as my host and partner organisations. So my NHS Trust are my host, and the partner organisation, the primary one is UCL and the secondary is St George's. And that's because my primary supervisor is the Professor of Speech Therapy at UCL, and secondary supervisor is Mel, who's at St George's. So I've been really lucky to have two fantastic academic organisations able to kind of contribute to my application form. I met with these supervisors early on, and we did some Zoom meetings together, and I think it was really useful to have a really clear plan of how in the PCAF Bridge we would meet and how that would progress me. Because the PCAF Bridge is quite short, you need to have quite a clear plan in place already when you apply. I also did some stakeholder engagement as part of my preparing my application. I did a Zoom group with the Alzheimer's Society, with some dementia patients and caregivers, talking about my topic area and getting their feedback. And that helped with the application form, but also with my confidence that this was an area that was important to research. I attended a similar information session to this one, which is quite helpful because sometimes the information on the website can be quite dense. And I think what I learned doing the application was that it's an iterative process. I think I've got about 8 or 9 versions of my application form saved still, and it changed quite a lot because I had really helpful feedback from my supervisors and also Dr. Kirstie Coxon at St George's. Basically read my application and fed back perhaps it was a little ambitious because I was hoping to do a research project within the PCAF Bridge, but she helpfully fed back that there might not be time for that, and I think that's made my application much stronger. Also, I met with my research and development department at the NHS Trust quite early on. I think it's important to explain to them exactly what the scheme is because they might not have come across it before. It's quite new, and they will need to help you develop your budget, so work out what your salary costs will be, and 2 people from R&D have to sign off the application as well. So you need a lot of time to fit all that in. So what I learned and what I would suggest to people applying this time, yeah, make sure you have enough time. Start early, even if you can get a first draft of your application and send it to supervisors early to get their feedback, then you won't get into that panic position where you need to change it and it's nearly the deadline. I think the application is an opportunity to give a little bit of a story about yourself because it is a personal award to develop you as a researcher. Talking about where you've come from, how you've shown your commitment to research already, and then really triggering, kind of thinking, why is now the right time for the PCAF Bridge? What is it about your experience that has led you to this point? And I think it's also very important to project what you're going to do next. And with the PCAF Bridge especially, it's kind of a bridge to somewhere, which is the doctoral fellowship. And you need to really clearly specify how you're going to get there. it is a personal award, but I think it is also about the team you've got around you who can help develop you. And I think about a third of the marks on your application when the NIHR rate it are to do with your supervisory team and your organisations you're working with. And I got full marks for mine, so I was really pleased with that. So I think thinking really carefully about your supervisors is quite important. Not only this, but kind of sharing your ideas for your PCAF with a wider network, your clinical network, your other research network, and other stakeholders will help you to develop your ideas and feel confident in your application. For me, as I said, it was very important to rein in my ideas and perhaps start with an application and then reduce it by about a third was what I probably needed to do. Be realistic about what you can do in basically mine's 2 days a week for a year, so it's not that much time. I think have confidence in yourself. The application for the PCAF Bridge especially is a chance for you to show what skills you've already got from your masters, for example, and to kind of just hone in on maybe a couple of skills that you think you really need to target in order to get to the PhD level. So for me, it's about getting some more publications. What's also helped my confidence is sharing my work with other people. And once you start getting that feedback from people that it is an important area to research, it will help you sort of say that clearly in your application as well. And just a slightly more dull one to end on, but I think in the application form, you know, this is a chance to show that you can write well, because the NIHR will want you to be able to write publications and write your research up. So try really hard to make your writing clear and organised. I got a bit of feedback that was that it could be better organised. So again, having people review your writing will help with that, but also maybe using frameworks to structure your application, and certainly something like a Gantt chart to show you've thought about timelines and what you're planning for the whole year. I've left my contact details there. Feel free to contact me with any other questions, and I'm around for the rest of this session as well. Thank you.
Thank you so much, Anna. That was really helpful, and you reminded me of so many of the things that you have to do for an application, and I'm sure it'll make the next one so much easier, really. Lots of challenges on the way, but some really helpful points. Thank you, and best of luck with that. And yeah, there have been some questions, so we'll keep them for a little bit later so we can keep the flow. So now if I can ask Greg to upload his slides and tell us a little bit more about his journey. Hi, Greg.
First of all, it's great to see so many people turning into the workshop and showing an interest in the PCAF. It's a fantastic award, and thanks also for inviting me to speak today, Jackie. So I'm Greg. I'm a physiotherapist and now a senior research therapist at the Royal National Orthopaedic Hospital up in Stanmore in North London. And this is a new split role that I've had just started in the last couple of months since I finished my PCAF. So I did my PCAF from October 2019 until end of November last year. I got an extension due to return to practice in the first COVID surge. I did mine full-time over 1 year, so I did roughly 80% research and tried to take up the 20% clinical development time where I could. So in my PCAF my academic host was joint hosted between St George's University and the Population Health Research Institute there, because my primary supervisor was Professor Michael Usher. And I was also joint co-hosted by the Centre for Applied Health and Social Care Research department that these guys are from today, as my second supervisor was Professor Michael Hurley. So I'm going to talk similar to what Anna did and talk a bit about my research experience, why I applied for the PCAF, and try and give some top tips for the application as well, and talk about that process. So my pre-PCAF research experience was kind of, you know, traditional in clinical practice. I was very interested in doing service valuations, quality improvement projects, audits. I was getting involved in research and being a participant and learning as much about the process as I could. And I always found this really interesting, and learning about the evidence base when trying to put together projects and quality improvement projects, service valuations during clinical practice. I was able to present my undergraduate dissertation at the World Physiotherapy Congress in Singapore, which was a bit of a surprise to me to get accepted to that, but it was an amazing experience to go there and meet some amazing people and present with them. And as Professor Tom Quinn said at the start, the first step in the ICA pathway is the HE internship, which I completed at Kingston St George's from September 2018 to April 2019, which was 2 days seconded out of clinical practice to complete the internship. And it was really during the internship I used that to explore whether research was for me and whether I wanted to have a clinical academic career. And the internship was great, and it really inspired me to move on and apply for the PCAF. And moving on, so why the PCAF further? So as I said before, I was always very involved in doing evidence-based practice and trying to answer clinical problems and clinical questions with evidence, but I started to realize there wasn't great evidence for some of these areas. My clinical areas, I'm a chronic pain physio, where there's lots of good evidence, but also not so much in good areas, especially in some of the kind of self-management behaviors, and physical activity is my particular research interest. And I wanted to lead research and make a difference and answer some of those clinical questions, clinical problems that I had in my mind. And then the internship, I said, inspired me on to wanting to be a clinical academic and explore this career more. And I very much knew from there that one of the best ways to have a successful clinical academic career is to have a PhD. And I thought that the PCAF seemed perfectly aligned to me from who I speak to and what I heard to prepare me for a PhD fellowship. I know this is very different, as you can see from Anna. She had a bit more experience than I did before the PCAF, so it seems the PCAF Bridge was more appropriate for her. But for me, I think that doing the full PCAF was getting the right level of experience for me to prepare for the PhD. So during my PCAF, I completed 3 courses, and I remember I did a standard PCAF, so it's full-time over a year with more money and more time than the other options in the PCAF Bridge. So I did a combination of methods courses and a PG cert as well, and some of the free PPI workshops that are held by the NIHR. So the patient and public involvement, as you've already heard, is really, really essential. I did have the time to complete a study, so I did a systematic review and meta-analysis in physical activity and chronic pain, which has been, some of the findings from that have been essential and are going into forming and refining my CDRF application. I've done some patient and public involvement group, which was bolstered by getting some additional funding from the London Research Design Service to fund some of my patient and public involvement activities. I've had some time to plan and write my clinical doctoral research fellowship application, which I'll be submitting in the spring in the coming months' time. And having that time during the PCAF to really think about that and read and refine your ideas and speak to people and build a network has been really, really important for that. I think Anna said an important part of your CV is having some publications, and for me, I was able to spend some of that time during my PCAF collaborating on other projects within my clinical service and finishing a project I did during my internship as well. And it's really important to be able to kind of build on different skills and get experience using different methods, but also on building a publication record, which have some papers that we've submitted and hopefully we'll have them out soon. And also work on clinical practice and clinical development for about 20%. Obviously the COVID surge had a bit of an impact on my plans, but prior to that, I was like spending time with some of our consultants in clinic, spending time talking to people at other trusts and other services within the same area and seeing how they're doing things, and really learning more widely about chronic pain and chronic pain rehab and trying to expand on my clinical experience, my clinical knowledge. So just to give a bit of a timeline then, and this is a good idea from Anna to start early and definitely would be one of my top tips, was, as I said, I applied for the PCAF in the spring of 2019 and started mine in October of that year. But really, my application idea started, so I started the internship in the September of 2018 and was hearing more and more about the PCAF and what it was all about and speaking to people who had NIHR awards. And I was realizing, yeah, I think this is the right thing for me, and was able to refine and choose my research topic during that time. And then I spent the rest of the next few months meeting with people, speaking to potential supervisors, seeing if that relationship was going to work, and trying to build my team. The NIHR advocates are an excellent excellent group of people from all the professions that are really, really important to you. And if you haven't got in contact with them yet and you're thinking about it, that's a really important people to speak to. But also speaking to managers and getting them on board, letting them know what it would entail is really important. And then over the next few months, again, it's about meeting with supervisors, mentors, meeting with the Research Design Service, getting their feedback, and the advocates. The Chartered Society of Physiotherapy led an event which is quite similar to this one today for purely physios to get some advice then. And then it's about writing, lining up, getting people, gathering your referees, and people need to sign it off. And as Anna said, it's an iterative process. Throughout all of this, I was really refining my training plan and what I thought I could deliver over that year, reining myself in, adding things, prioritizing certain courses or certain projects, and really refining what was going to be the best way to do my PCAF. And again, my application top tips are incredibly similar to Anna's. I'm not sure I'm adding too much extra than what she already said, but start early and keep up that momentum. If you get going with something, keep going, keep working at it, keep talking, keep thinking. It's really important to get all your ideas down and build it up, and time is the best way to spend in terms of refining it. But be really strategic. For me, it was really important that all the components of my PCAF made sense. They all linked together for that in order to provide training for that year, but also to think about, well, what do I need in order to kickstart my CDRF? What's important to have at the start of that? What can I use the PCAF for in order to develop those skills, whether that be the training I did, the team I built, the research project that I was able to do. And that, moves on to building a team. And I think, supervisors and mentors are really important, but also having good collaborators is really important. These are people you might work with during your PCAF, or you might hope to work with in the future, or people that have an interest and experience in your research area that can be really important people to guide you through. I found it really, really helpful speaking to people who had other NIHR awards currently or before, whether that be current or past PCAF holders. I had a WhatsApp group with other PCAF awardees, and it's really, really helpful to have those people and that support. And I found that the NIHR community of people that have fellowships or involved in the NIHR Academy are really, really helpful and supportive people, and it's really good to keep speaking to them and get their advice, and they're always being willing to help. Contact the the Research Design Service, which is appropriate to your region. They're really, really helpful. They'll read your application, they'll give you some advice, they'll meet with you. And similarly to above, start building a network of people around you and have some ideas about how you can work with during the PCAF as well to keep building on that. And it goes without saying, the guidance notes are really important, and so are the previous year's chairs reports. There is a long document, the guidance notes, but it really, really is important. But also, they can be very broad, so speak to people about them as well and get some more clarity there. And so my contact details are there. And if you want any advice, I'm happy to speak to anybody. And please get in touch. It's really important to speak to people about these applications and get their experiences.
Thank you so much, Greg. And again, highlighting the challenges, but they're not insurmountable. And networking being important, making sure you're strategic and that you allow a lot of time. And it's always good to hear that the NIHR fellows and awardees, you're handing the gift over and sharing your knowledge and skills. So thank you very much for your time. I'm going to hand over to my colleague Kirstie, who's going to share some top tips, some more top tips really, and guidance. Thank you.
It's been great listening to Greg and Anna, particularly because they told me all the tips that I should have in my presentation, but I haven't. So but, I think thankfully we've come from slightly different angles, because they've given really helpful advice for the process of applying. I've taken a bit of an overview for preparing an application. So hi to everyone, I'm Kirstie Coxon, I'm Associate Professor for Midwifery. I'm also, as Scilla and Jackie I think mentioned, an NIHR advocate for clinical academic careers, as Jackie is as well. And I'm the ARC South London Training and Education Lead as well. I'm very grateful to be invited to talk about this today. Something very near to my heart. I had when I did my doctoral, NIHR doctoral where the PCAF wasn't available, so I didn't have this option open to me. And as a consequence, I could only do a doctoral fellowship. I wasn't able to maintain my practice. So I'm so glad that they've added this strand into their fellowship offer. Okay, so the NIHR PCAF Award 2021 will be the 4th year of the award. It's also the 2nd year where the PCAF Bridge Award, which Anna was successful in applying for, is an option for applicants. So only the 2nd year for the Bridge. And the Bridge, as Tom and others have mentioned, is really for people who have already either got an MRes or equivalent master's training and experience. But what that means, what those 4 years of PCAFs means, is that many NIHR Clinical Doctor Research Fellowship applicants have now held PCAFs. And during those PCAF awards, they've really strengthened and developed their doctoral fellowship applications. So PCAFs are really valuable because they're helping people get clinical doctor research fellowships, but they're also slightly raising the bar for those fellowships. So it's maybe a bit harder to get them if you haven't done preparatory work. So I think it's really well worth considering going for a PCAF, even if you think that means it'll take you a little bit longer to get to where you want to go. So we don't know exactly yet when this year's PCAF will be advertised. NIHR has said that they will run it, so we can be fairly confident it's going ahead. The website currently says it'll be advertised on the 28th of January. So that's my first tip, is to just keep checking the NIHR website and their Twitter account, which is brilliant, to find out the updates and to be aware straight away if the fellowship has been advertised. Because the day that they advertise the fellowship, they'll provide all the dates for applications, and you'll have a kind of better idea of your workload if you're planning to apply for one of these. I was talking to some people this morning, and I have no inside knowledge on this at all, but I suspect that the current pandemic situation may impact on these dates as well, so it's worth bearing that in mind too. So what do you need if you're going to do a PCAF application? Well, this is drawn from the checklist that one of the research design services put together, and I've slightly added to it. Because the first thing you'll need, and Anna and Greg both talked about their project ideas, you need a PhD project idea, not a fully formed proposal, not an exact plan, but an idea which is feasible for PhD or doctoral study and which addresses NHS or NIHR research priorities. So that's important to bear in mind because they do publish their priorities. They're things like, mental health, long-term conditions, important areas where they really want people to focus research activity, and that helps with funding applications. You'll need a strong plan for patient and public involvement in your research. So they want to see from this earlier stage that you're engaging with the people who your research would affect and asking for their advice about your question, about what matters to them as patients or service users. And the NIHR will want to see engagement right the way through the research process. You'll need at least 2 academic supervisors who are potential future PhD supervisors for your doctoral study. And for an NIHR application, these should be people who have PhDs already and experience of PhD supervision. And ideally, NIHR like to see someone who's got really well developed experience, or with several students having gone through the PhD process, but they're quite accepting of 2nd or 3rd supervisors who perhaps haven't got that extensive experience, but have some experience. You'll need a university, sometimes called a HEI, Higher Education Institute partner, and that university should be the university that employs your main supervisor. And you'll also need an NHS or eligible organisation partner. Sorry, that sounds really wordy, but what I mean is it's not just NHS trusts. It's come up in the questions. Can local authorities be hosts? Yes, they can. Certain non-NHS but care providing organisations can. And the litmus test for NIHR is, does your organisation provide care which is free at the point of delivery to the patient or client group? if it does, it's likely to be eligible. So you need those two organisations involved, and you also separately need a clinical academic mentor. And that's someone who's already developed a clinical research career within an NHS setting. And it might be someone with the same clinical background as you, or it might not. But it should be someone who has done a PhD and can help you and mentor you towards doing clinical academic research based in a healthcare or a local authority setting. So I won't look at these all in detail, but these are examples of evidence you can use to support your application for a PCAF. Because if you look at the actual application form, it's mainly made up of a personal statement detailing your own narrative, your interest in research, how it developed, what skills you have, what experience you have, what you would like to develop further, where your interests lie, what project or clinical question you're interested in. And sometimes people feel a little bit intimidated by the form, and they imagine that they're expected to be published, to have research published, but that's really not the case at this level. The NIHR would like people to have perhaps published, but it might be that you've published a piece of work in a professional magazine rather than necessarily a peer-reviewed piece of research. Or you might have presented to regional or to your own trust audience about audits or service evaluations that have taken place. You might have had a small amount of money to develop an idea or an innovation, and all these things are transferable onto a narrative about your own research interests and CV background. So you don't have to have high impact journal publications at this level. And you may well have other transferable skills. You may be involved in a charity that's doing work in your research area, or you may even have set up something for patients or service users. You may already blog about your clinical practice. And all those sorts of skills are really helpful because they tell the NIHR that you're someone that wants to talk about and raise the profile of what you do. So be willing to think a bit broadly. And others have already mentioned these, so that's great. But yes, absolutely. A tip from me is make use of the NIHR support infrastructure, because the NIHR invests in the infrastructure around us to help people get support for fellowship applications and for funding applications for their funding streams. But the three that are immediately available to you are the NIHR advocates, and I've put the web link in there, and I will show these slides. So you can talk to any advocate, but there are advocates for most different clinical professions, and you may well want to speak to someone with your own disciplinary background. The NIHR Research Design Service has also already been mentioned by Greg, I think, but absolutely you're eligible if you're applying for NIHR funding, you're eligible to seek their support. NIHR London have a really informative website, loads of drop-in sessions, and you can also self-refer for one-to-one support if you're doing an application. And for those of you who are nurses or midwives, there's an NIHR incubator specifically to support the nurse and midwife applicants. And that's partly because nurses and midwives, we don't do brilliantly, considering we're a very, very large set of professional groups. We don't apply as often as you might expect, and we're not as successful as you might expect with those that when we do apply. So the NIHR is invested in the incubator to support nurses and midwives, and that's really having a great impact. Actually, it's only been going for a year or so. I'll put the link for that as well. This is a photo of the original group of NIHR advocates. I include it just so you can see that we're human-friendly and approachable people. No, advocates don't get paid for this role. It's purely something that we do as part of our existing roles to encourage, support and mentor those who are looking to have fellowships. And really because we want to give people the opportunities that we ourselves have been lucky enough to experience. So the final slide I have here is the tip. As Anna and Greg and others have mentioned, you need a university and you need a trust. So my tip is to talk to them as soon as possible. And that's because it's difficult for you as potential applicants to identify possible supervisors. So it takes a little bit of time to feel through your way through those relationships and to find the right sort of people and team around you. But whoever they are, they need to communicate with you and with your trust employer or your local authority employer, because between them they have to write a combined support statement which shows in a very personalised and individualistic way how they will support you, how aware they are of what you want to do, and to persuade really the NIHR that this is a safe arrangement for them to invest in, and that your project plan will be realised, that the plans that you have for your PCAF. So do talk to them as early as you can and start those negotiations going. Okay, and that's it from me. Thank you very much for listening. I'm staying around, so I'll be here for the questions at the end as well. And I've been typing a few little bits as we go along.
Thank you very much, Kirstie. That's fantastic. I think, Jackie, you're going to chair our Q&A session now. So we have just under half an hour, because I'll just do a brief wrap up at the end. So I think everybody who's spoken is going to put on their cameras. And when Jackie presents a question, she'll either target one of us or wave to offer to answer. Thank you very much.
Thanks, Scilla. Yes, there were some early questions around the eligibility of certain applicants. So we had queries about social workers applying, and Rick Hood has put in a link for the PCAF arrangement for social workers. I don't know if Rick's on here, but Kirstie, did you want to comment on that?
Yes, I'd love to. I think Rick is here. But I'd love to comment in the sense that social workers have always been eligible, but rarely take up the opportunity. And that's part of the reason that they're setting up a separate scheme, which is really entirely aimed towards social workers. I think Tom's going to come in there as well.
Yep.
Yeah, thanks. Yes, sorry about that. Yes, actually, social workers should have been on my slide. I apologise for that. But as Kirstie says, we are looking at alternative ways to support the development of social workers as in their practice academic careers, if you like.
And the other group, somebody asked whether nurse academics were eligible.
Okay, so shall I take that?
Yes, please.
So to be eligible, you have to be employed at least 50% of your time by an organisation that provides at least 50% of care free at the point of delivery, and you have to be in a role that is providing that care. Honorary contracts with NHS organisations are not eligible. Bank contracts are not eligible. Fixed term contracts are eligible. So if you have if you are a university academic, then this is about planning ahead, about organising a fixed term contract so that spending at least 50% of your time in practice with an eligible organisation. Otherwise, what this scheme is not about, what NIHR don't really want, is to develop people who will then go and spend all their time in universities. This is about health and social care, developing clinical academic careers for people who will stay in those roles with half their time in practice and half their time doing and eventually leading research.
And someone asked whether if someone has undertaken an MPhil previously, can they apply for a PCAF?
Shall I do that again? Sorry. Yes.
Yes.
And actually, the wording in the guidance is very subtle. So there are two things. If you've already got an MPhil but you're now back in practice, you are eligible because you've done master's level, but you would have to justify what the added value in terms of your personal research training will be to help you develop a competitive doctoral fellowship application. If you have already registered and are currently registered with a university to do a PhD, then most universities, first of all, register you for MPhil until a year or two down the road, you do an upgrade assessment and then move on to complete your PhD. They're different things, and they're different things in the guidance. So if you're a health professional now back out in practice who happens to have an MPhil and thinks, well, actually, there are gaps in my knowledge in terms of research methods or my track record or whatever that I need to address before applying for a doctoral application through a fellowship, then fine. But if you're already on a program registered with a university now, with an aim of doing a PhD, of which MPhil registration is part, then you're not eligible, I'm afraid.
Thank you for that, Tom. Another query that, again, you might be able to answer was from a paramedic who said that they were interested in doing a master's in ACP and whether PCAF was the route for them.
So this is a research training program. This is about developing the research leaders in the health professions for the future. So a master's in advanced practice that doesn't have a significant research training component is unlikely to be something that NIHR will fund through this scheme, I'm afraid. This is about, the whole point of a PCAF is to help you develop your PhD application. That is the bottom line with this particular scheme.
Thank you. And I think these questions have triggered a number of others.
Jackie, can I just come in on that one as well?
Yes,
just to
please.
back up Tom's point as well. So originally the NIHR did fund the MRes, and St George's, we hosted the programme and had over 100 applicants come through that programme with NIHR funding. But I think although we were successful in people moving onto the doctoral stage and beyond, across the country, they felt it wasn't as successful as they hoped, which is why they introduced the PCAF. And the PCAF, for applicants in the beginning, I think although it does include funding for your training to upskill you, if you just are pretty much using it as a vehicle to do an MRes, that's not quite the point. They're looking for you to, and actually to complete a whole MRes, as well as develop a really excellent application, and to do some PPI work, perhaps get a couple more of your publications done. It's a bit unrealistic. You won't fit it all in. And the overall goal is to produce a really excellent application and a really competitive application with all these areas covered. So do certainly look at MReses or advanced practice if there's key modules where you think I could really benefit from spending money and doing that particular training, that particular course or particular module, which would really upskill me and help me accelerate my clinical academic development. And certainly we have Jacqueline Bennion, who's currently with us as a PCAF. I think she's doing the PG Cert, which is the first year of the MRes, to upskill her research method skills. So don't rule it out. Kirstie is also the program lead for our MRes, and we also have advanced practice. So, you know, in terms of combining key modules. So you are looking to develop your clinical development as well as your research development, but you've got to be very careful and pick just the elements which really help you to put in that competitive application. Thanks.
That's great. And I think that answers the questions people are asking about whether to do full-time MReses rather than modules. But I think, as you say, Scilla, the idea is to bespoke the training rather than getting a whole MRes under your belt. Anyone else want to comment? Yes, Tom.
Just come back just to say that one of the speakers earlier talked about the Vitae framework. It's really useful with your potential supervisor or mentor to look at the Vitae framework, to do a self-assessment of what your particular training needs are in relation to research. And having evidence of that in your application is very powerful. And it demonstrates, it was Anna, wasn't it?
Yes, that's right.
That you've thought about it, you've sought advice, and you're developing your own plan for this fellowship. And again, with the aim of, at the end of this, you will have written a competitive PhD application.
And Kirstie, did you want to add something?
Yeah, just to add to what others have said about this difficult question of if I've already got a clinical master's, should I apply for a PCAF or a bridge? It really is depending on you and your existing research CV and experience. So in some cases we'll be saying, yes, you probably should do a full PCAF. And others will be saying you're eligible and appropriate for a bridge award. That's something to talk over with someone like or any of us, or an advocate, or your supervisors, because it's really is a personal decision, and it depends not just on your qualification, but what other research experience you have since.
Thanks. And just picking up on something around regions, actually, it might be useful to point out the NIHR schemes are for England only. There are some similar parallel schemes running in the developed nations, but someone has asked whether you can make an application if you live in the Channel Islands.
Oh, pass.
Well, it depends where you work, who employs you, and which university you are going. But actually, my understanding is we're talking about the NHS or social care in England, or third sector bodies in England that might be eligible, and it must be a university in England.
Okay, I'm just going to come up with some of the questions that came up earlier. I wanted to mention questions around the host and the partner organisations, where they're located, and in terms of speciality. So I want to make a comment on hosts. I know, Anna, you had to make decisions around host organisations, so you've not gone with your clinical host. Do you want to talk about?
Yeah, my main host is the clinical NHS Trust, and my partner organisation is UCL, which is the primary academic host. So I think I just made that decision based on that. I think usually the NHS Trust is the host. I don't know if that's to do with it being easier to organise your contract, your employment contract. If you're already employed by that organisation, then they can hopefully sort your contract out more easily than having an academic institution create a new contract for you.
Greg, Greg, did you do a similar thing?
Yeah, I think the same reason as Anna really is. It seemed like the done thing for most people I spoke to, that the NHS Trust employs me, so they were my main host, and then it was just, yeah, supported by the universities.
Okay, thank you. Just picking up some
Jackie, can I chip in on that?
Yeah, please do.
Because it's quite a hot topic at panel discussions. So basically, if you apply with a university has to add overheads because it's equivalently to a research application to the NIHR. That uses up a lot more of the funding, and less people can get funded for their award, and the money goes to the university. So really, your substantive contract, if it's with an NHS host, the NIHR panels would not expect you to have all your payments go via a university to be paid back to your clinical host, and for the university to cream off the overheads. So it's not really in the spirit of things. And I think there is going to be further guidance on this forthcoming, because the NIHR, obviously, it's taxpayers' money. We should be spending it wisely. And although universities do a lot of great things, the number one option is normally, if your substantive post is in the NHS, which normally if you're 50% of your time is delivering that, then that free at point of delivery, then because of the criteria, then you really would be expected to have your site, which is going to receive the award, as your clinical site. The academic site really doesn't receive very much at all. I mean, it's just a small amount, about 500 or something like that, isn't it, for the university? It might be you're giving a little bit of your training fees, but it might be that the clinical site actually pays that directly to the university. So it doesn't necessarily, it's really for the greater good that the academics are supporting your development, and they want you to go on and succeed and do your doctorate and become our future research professors. So
yes, definitely different motivations for each bit of the organisations that host you. I know James has asked some questions around part-time, full-time, and I know increasingly the PCAFs are being offered part-time versus full-time. Any guidance or direction as to how people should make those decisions? Are there pros and cons? Anyone interested in that?
Well, I think if the question is half-time of what, so it depends on what your current contracted hours of employment are, and being able to fulfill the the requirements of the funder to develop your competitive doctoral application, complete all the training, etc., during that time. I think this is a sort of thing where, because it is quite nuanced, I would contact NIHR direct and ask them. I think we don't, my view, I don't speak for NIHR here, is we don't want to disenfranchise people who have other commitments, who can't work full time. So there will be a bit of flexibility baked into the system, but I think the details are probably best put direct to NIHR for advice.
Increasingly, people may pick up a day or part-time hours in an academic environment, so almost like developing a clinical academic type of role. So I think this is where that's our day-to-day roles sometimes might be cut up, which is why you're left with part-time clinical.
But it's about how much time you've got to complete the requirements of what the funding's for, which is to develop that competitive application at the end.
Lovely, thank you. Oh, and Kirstie's added.
And that's exactly what I was trying to say, but it's put much more eloquently there.
Absolutely, yeah, no, definitely. NIHR want to be inclusive, and I think increasingly they understand that there are a whole range of different arrangements that people have in terms of employment, including outside the NHS. So you mentioned charitable organisations and community trust that are perhaps funded outside of the NHS but delivered free.
Yeah, and while you're on charitable organisations, I just mentioned that NIHR have partnered with some of the big charities in particular areas of specialty, if you like, to do partnership fellowships. And I'm going to have to scroll down to the bottom here to try and remember which ones they are. But there are some that maybe you may think, oh, well, if I link up with that charity now, that would be advantageous and strengthen my application. And that charity, of course, might actually pay part of the award. Yeah. And I can't find it now.
I think, is it diabetes?
I think it was
arthritis. Kirstie's got some.
Yeah, I think diabetes definitely. Wellbeing of women have got one. Stroke. I'm sure the Stroke Association has.
That's what I thought. Yeah. So do look. The website actually has huge amounts of information. I know it's dense, but it's useful to come back to for queries. And of course, the people at NIHR are always very open and willing to take questions. RDS are also should be one of your first points of call, alongside a whole list of other people we've mentioned already today. Any other questions or comments?
So Susie Williams asked about whether or not we know of people having full masters funded as part of PCAF, and Tom will know best being on the panel, but I believe they do fund full masters.
It's possible. It's possible. It's about how you justify your training development needs as an aspirant clinical academic researcher. And if you haven't got a first degree, for example, then actually you need to have a master's degree to apply. But of course, not all master's degrees include a significant research element in this, with all the training in methods and statistics and all the rest of it. So I think you just need to be, again, this is where the relationship with your potential supervisors and your clinical academic mentor are so important, and your self-assessment against the VITE framework.
Thank you.
Yeah, I think that's true, and it's also it's good to think about why would you want to do a master's, because we often think you have to have one to do a PhD, but that's not the NIHR's perspective at all. They look for equivalent skills and experience, but you don't have to have that on your CV necessarily. But if you have got a clinical master's and you've never done research training, it might be useful to do the PG Cert, for example, which quite a few institutions offer in research skills and methods, because then you've got 60 credits of recent study showing that you have those skills to complement your existing professional masters. And I think,
and so the key thing is, if you are applying, sorry to talk over you, Kirstie, if you are applying for this and you are putting a master's in, you must provide a strong argument, and it's very, I always think when I look at the beginning of applications, so where does this person want to be? So making a very clear statement that you aspire to have a clinical academic career. It's really important.
It's definitely
really
about the pathway, isn't it? Yes.
It is really important, because this is what this taxpayers' money has been devoted to.
And it's fair to say that other masters are available and other training options.
And if the panel are looking at your application and think, well, this person just wants to have a master's, or even this person just wants to have a PhD, but there's no mention of the ambition to become a clinical academic and what that might look like in your future career, then that's not what this scheme is for. I keep doing lots of negatives. I'm not being negative. I'm trying to provide some pointers to help you.
No, I think it's important because I think, as you say, there are some people who want to undertake a master's, or it's a requirement perhaps of a role. And I always say that this is a fellowship, so there are added things that both you are required to do and that you need to demonstrate that you will do and deliver in the future. And that's why it's competitive and quite arduous, whereas you can get a place on a master's far more easily and take your time with considering what you want to do next. Let's see if there's any other questions. Okay, we're almost coming up to time to hand over to Priscilla. I'm hoping that everyone had access to the chat. That was the only other thing I didn't think of. So I presume if anyone can't access the chat and wants to ask a quick question, you can unmute yourself. Okay. Priscilla, I wondered then if you want to...
Sure, yes, thank you very much, Jackie. Yes, lovely. Well, first of all, can I just thank all our speakers, particularly Anna and Greg, who've taken the time out to tell us about their personal experience, which I think is really, really valuable. Thank you very much. And thank you to all of you who've joined us today. Obviously, we're very passionate about supporting all our colleagues to apply for clinical academic routes. But we know that the NIHR is pretty much the gold standard one. It's a very competitive one. So, and actually, when people do apply and they get feedback, I know I see this on the clinical doctoral fellowship panel, if you take that feedback and really use it and apply again, research careers are all about resilience and bouncing back. That's often gives people a very good chance to succeed in these funding awards. But again, seeing I'm now Deputy Chair on the Clinical Doctoral Fellowships panel, and practically every single person who would apply, not even those who come through for interview, but even those who apply, have the capability to do a PhD. It's just that there's a limited pot for NIHR awards. So even if it means that you can't progress through the PCAF and onto the Clinical Doctoral Fellowship route, don't give up on your ambitions. Do still keep those ambitions and keep working towards other fellowship opportunities or support from your employers. So because you will find there are opportunities there. A lot of us, some of us older crowd here, there weren't these opportunities around when we wanted to develop our expertise. I think I did the first master's in occupational therapy, and when I first thought of doing a PhD, I was told you don't really need one, but if you're passionate about understanding why things are effective and getting the best services for the public and our patients, you are driven to keep going. So please don't give up, even if you don't succeed with this particular scheme. I think also really just to reinforce, the PCAF has come about because of the recognition that the funding the MReses wasn't leading to as many people as they wanted coming through onto the pathway. So just be careful about just going with the old style, but make sure you really go with this new approach of what the NIHR is looking to fund. Make sure it's really bespoke to you. And some people in the chat asked, about could you move further away from your local area for your academic site? Yes, definitely. The key thing is you find those experts and you find that environment which can support you. And in terms of the clinical environment you're in, really, as people start to put through their clinical doctoral applications, the NIHR are looking to check that those clinical environments will support people after they've successfully completed their doctorate with the next steps. So they're looking for that long-term investment. So they would like to see that there are some members of the community there who are actually given clinical academic time within their substantive position, and that they aren't just returned back into the same position they had before they started, or that they're lost just into 100% academic positions. They really want to see that your clinical environment is able to support clinical academic career pathways. And so do look at where those who've been successful to date. I believe you can definitely look on the NIHR website at successful candidates. Look where they're working, perhaps, and perhaps contact some successful people and ask them if they'd share their application with you, if they give you some advice, and also the NIHR advocates, because they're real experts on the scheme. So I think we've put in the chat a couple of times the contact email address if you're particularly interested in applying with our faculty, or one of our partner universities. But the most important thing is to find the experts who can support you and what your passion is for your area of research. And so just to finish, to wish you the very best of luck with your applications and or which other types of schemes you might go for. The Wellcome Trust has also started doctoral training fellowships for health professionals, so that's another avenue for us. So, and take great care in these quite difficult times, and we'll finish our session there, and everyone who's registered will be sending out the recording. So thank you very much, and good luck.